Hello, I'm Philip D. I'm one of the cancer specialists here at Crossroads Cancer Center in Effingham, Illinois. And we are part of a very big group called Cancer Care Specialists of Illinois. And there's several of us here in Crossroads Cancer Center, and I am the medical director here at Crossroads Cancer Center. I was trained as a medical oncologist and cancer pain specialist and hematologist all in one when I was in Philadelphia. And it was strange to combine all those specialties in training, but luckily I had a chance to complete all those when I was in Philadelphia, and I was also able to do a lot of genetics training before coming to Effingham. So I've been here in Effingham for at least 20 years now, and there's been a big growth in the last 20 years in cancer medicine, and I was very lucky that I was able to have as much experience as I can before I came here and been able to help me throughout the last 20 years. There are several people who go into oncology for different reasons. Mine was more personal, plus the fact that I had a great mentor when I was in New York City. When I was growing up in the Philippines, I had several family members who died of colon cancer, and I felt so helpless. Um, and and I just wanted to do something, a little part that could make cancer eradicated in this world. And I felt that once I had more special training here in this country, that would be the specialty I wanted to do. But that was reinforced by the fact that that several of my mentors in Columbia University in New York City were really very compassionate cancer specialists, and they really paved the way for me to really strengthen my belief that I could really be a good cancer specialist through their compassion, through their dedication, and how they take care of patients. So and that really helped me. And finally, there have been so many cancer patients that I've dealt with in the past before becoming a cancer doctor who I have been touched by their resilience and the attitude that they have, that there's always hope no matter how bad or how doomed things are, and they never give up. And that's the human spirit that I was so inspired, and there's no way I cannot be a cancer specialist. If you are a patient here at Crossroads Cancer Center, you are always in the driver's seat. We are here as partners. We are here to give you the best chance of being cured. And if we are not going to be able to achieve cure, we are here forever with you. We are here to support you from diagnosis until success, no matter what the success would mean. And we don't have all the answers. And we are very lucky that we have cutting edge research that we do here, right here in Effingham, Illinois. And we've been doing this research now for over 30 years. And we have it here in the office with our two research nurses available at any given time. However, we also know that we do not have all the resources, and that's why everything is a collaborative effort throughout the country. If there are some rare cancers that we come across, or you have a rare cancer, then we may not have all the answers. We will not hesitate to refer you ourselves to larger tertiary care centers, especially now with the MD Anderson affiliation that has become much easier now. And so once again, we are here, we're partners, you're in the driver's seat. We're here to give you advice, recommendations, but you are going to be the one who will make the decision. Whatever your decision would be, it's always the right answer. We're always here to support your decision, and since we're always here for you. Clinical trials is what we do every day. In my training back in New York City and Philadelphia, we were doing so much research and it was fascinating. I've been so lucky that I was able to join a group 20 years ago, which is Cancer Care Specialists of Illinois, that we had this vast portfolio of different research trials. In the last 20 years, we have been able to participate multiple promising trials that have changed the landscape of what we do for cancer prevention, cancer treatment, and even for supportive care and even pain specialty or pain relief for patients with cancer. And we've done several of those trials here locally in Effingham, and we are very proud that we've been able to do that. And I would have to give my gratitude to all the patients here in Effingham and surrounding counties who participated in these trials to make all these research successful. Without research, we are nowhere right now. All these advances that we have heard of, all these things you hear in commercials, none of these would be available without research. The only way we have gotten so advanced and winning the war against cancer, the only way has been through research. So I implore all of you that as a patient, we would need your help to eradicate this cancer, but the only way is participating in trials. If we don't offer trials for you, you always should ask whether there's any trials available. If we do not have a promising trial here, once again, we will be happy to refer you to elsewhere for a research trial that would be good for you, because we want to get rid of the disease once and for all. In my career in the last 20 plus years, there have been so many moments that I've been very proud of what cancer medicine has given me. Not only I feel that I have touched a lot of lives, which I would not have been able to do if I wasn't doing cancer medicine, but to see how patients are cured, to see how patients conquer this disease with all their will and their might, with prayer, that just uplifts you every single day. I don't think that there's a specialty that you will see the human spirit this strong and be able to fight all the obstacles that lies in front of them and in front of their family. And in cancer patients, I've seen it. Cancer patients have made me a much better human being, a much better doctor, which I know I would not have been able to do if I was doing something else. Other things that I'm very proud of would be I've had a couple of survivors and their loved ones who actually went into medicine and actually did oncology because they told me that I touched them. I touched their lives, and they up to now they communicate with me, and even some of them would want to express that they would want to work here in the Effingham office with us in the future once they're done with all their training. So those are probably my proudest moments that I think I hope I've made a difference, not just in the lives of patients, but also the loved ones, and of course our cancer survivors.